Hello, this is Chapter 4, Intervention Strategies, Sports Injury Prevention. I do this from two angles. Everything I say can be used for preventing injuries and rehabbing injuries. You should be able to flip them in some form or fashion. Now, most of the things I say, all right, this is how I teach injury prevention. When we rehab an injury, we have to work all the range of motion, that's ROM, of the joint. We have to look at 5 things. We have to look at their range of motion, okay? We have to work on range of motion. We have to work on balance, all right? We have to work on their strength, their endurance, their power. And then the 6th thing is sports specific. So 6 things is sports specific is the last thing. So the way we progress them is first I need to be able to bear weight. I need to be able to stand up on the area, okay? Then they need to be able to walk, okay, normally. That's heel to toe, big toe, okay? So heel goes around to our little toe. We push off our big toe. Then they need to know how to, we work on jogging, okay? And then we progress, we can go to backpedaling, because when you backpedal, you jog, okay? And then we can go to running forward, and we can speed up. After that, we can speed up our back pedal. And then we have, when you're cutting, but we don't go to sharp cuts, we make a S, which is soft curves. And then we go to Z's, which are sharper, more precise curves and cuts. And then we can move to lateral movement, which is shuffling side to side. Okay, so you've seen things where in basketball they sidestep, they take one step, bring the other foot. They should always be on the ball of their feet when they jump. They should land on the balls of their feet. They should not land on their heel. They should land softly. You should not hear a big pounding on the ground. They should also pivot. That's one of the main ways that the ACL is torn, is that they don't pivot on the ball of their foot. If their foot and knee are in different planes because they didn't pivot, then they just twist off the ACL. So they need to work on pivoting probably around the time that you're doing, S's, or you can do it a little bit before that, but they're not going to be running. It's going to be a controlled, stationary movement, where, not stationary, but they're in one spot, and they're just pivoting. Pivot both directions, or make a whole circle with one foot, and then pivot the other way, and then switch feet. So they should be able to pivot forwards and backwards, make a whole circle on both feet, because that's a muscle memory issue. When you grab a rebound, you don't think, okay, I need to pivot and pass this ball out. It's something that's muscle memory. You just do it, okay? So that's the way we rehab. So look at the 6 things I listed and look at the order that I just said. Make sure you understand the order of how we progress them. Now, when you look at, there's something in Chapter 4 called intrinsic factors and extrinsic factors. Intrinsic is more like internal, something inside. Examples of those are age, gender, body size, history of injury, fitness, muscle strength, especially muscle imbalances, ligamentous laxity. That means how loose your ligaments are. Ligaments connect bone to bone. Ligaments are not supposed to give. They're not supposed to be stretchy. Tendons are stretchy, but not ligaments. Skill. Psychological status. If an athlete is going through, I'll talk about this later in Chapter 5, but if an athlete is going through a death, or their parents are going through a divorce, a breakup, that's going to affect their play. Okay. And perhaps overall intelligence. So those are intrinsic factors. You as a coach don't have too much say-so in those those issues, those factors. Now, extrinsic factors, that's another story. Your equipment, the teaching that is done, the coaching that's done, the environment, the type of activity, and conditioning errors are examples of extrinsic factors. Those are wearing the wrong shoes on turf, practicing when it's too hot outside, practicing when it's too humid outside. Those are extrinsic factors. So if your athletes have heat illnesses and injuries, that is the extrinsic factor that caused them, was the environment. You can cut down on all that as a coach or athletic trainer or whatever you want to call yourself if you would pay attention to the environment. When you go to the gym floor, you need to sweep the floor. The floor needs to be swept. Are there any leaks from a rain? Is your roof leaking over your gym court? Okay? And giving a puddle. I mean, obviously, that can cause an injury. Someone slips and falls. That's the extrinsic factor. You should condition your athletes in running shoes. If you have them running, they need to wear running shoes, not basketball shoes or cross-training shoes. They need to wear running shoes. Conversely, if they are on a basketball court or a football field, they need to change their shoes, or whatever field or court, need to change their shoes and put on the proper shoes for that sport, because running shoes were not meant for lateral movement. They're meant for you to go straight and take some soft curves like S's and C's, not for you to make Z cuts. So that's chapter 4 so far. Intervention strategies. Make sure everybody has a physical. Look at the physical. Read the physicals. Who has a history of ligament injuries and sprains and ankle sprains and muscle strains, and who has asthma and who has high blood pressure. That's an internal factor. Common in football players at the high school level. Who has those things? All right. Now, having a physical, now here we'll go. You look at chapter 4, you need to know what 1 rep max is. What is a 1 rep max? And what is, how do you develop strength? Well, you develop strength, you take 80% of their 1 rep max, and they do 5 to 8 reps, okay? And then for endurance, you take 80% of that 1 rep max, but you do 12 to 15 reps. You do more reps to get endurance. And then power, you take 90% of that 1 rep max, and you do 1 to 3 reps, okay? So that's strength, endurance, and power. 1 rep max is how much, of course, they can lift one time. So you have to first test your athletes. If you're familiar with football, you know this, but test your athletes, find out where they are. Okay, it's also important to keep a running total. Every now and then we'll get their weight, all right, to know what their weight is. Because when in hot conditions, that becomes a problem. They should not lose more than 2% of their body weight in between your 2-a-day practices. Flexibility. That's the type of stretching. PNF, stretching. When you hold something, you do 3 sets. You hold it for 20 seconds. So you'll stretch. That's under flexibility. You'll stretch them, and then you'll push it. So say we're doing the hamstring. You'll push the leg back till they say stop. You'll hold it there for 20 seconds and let the reflex relax. Okay, and then they'll push against you and hold that for 20 seconds also. So it's 20 seconds. You pushing, and 20 seconds with them pushing against you. Now, that's 1 set. The second time, you should be able to go back further. They should be able to go back further with you pushing. And then hold it 20 seconds, and they push against you 20 seconds. Third set, they should be able to go even further. 20 seconds, hold it, and push against you. You just want the muscle to fire when they push against you. They're not trying to overpower you, okay? So we have static stretching is in the book. It gives the definitions, and ballistic stretching. This is going to be the end of part 1 of chapter 4, and then I'll record another video.